Thank you all very much. We're going to call up our next panel, Rita and Secretary Geisenberger. And panelists, come on up. And by the way, we have asked that the heat be turned on.
We don't have our high heels on.
Yes, I'm not wearing my heels.
Rick, short and sweet, Rick. Short and sweet.
Oh, I won't be totally short.
Sweet.
Good morning. My name's Rick Geisenberger. I'm Delaware's Secretary of Finance. Serving on Delaware's Healthcare Commission, it became really clear to me that every health policy issue that we face in this state, cost, quality, equity, ultimately comes back to a workforce issue, dependent on the size, the skills, the distribution, the diversity, and the training of Delaware's workforce. So under the leadership of Commission Chair, Healthcare Commission Chair, Dr. Nancy Phan, we created a Workforce Development Subcommittee. I think it's the only subcommittee of the Healthcare Commission, and I've been privileged to co-chair that, first with Highmark Delaware President Nick Moriello, and now the incomparable Dr. Kathy Matt. So I'm thrilled that this summit is shining a light on our workforce challenges and setting us up on a collaborative path for success. We can address these challenges, and frankly, we will have a competitive advantage relative to other states if we can figure this out. For those of you who still read the News Journal, there was actually a headline in the News Journal, I don't know if it was coincidental or not, this morning that said how Delaware's leaders can improve access to health care. So this panel is well positioned to talk about that. I want to recognize some people, I'm not sure if they're still here, but some of our leaders who were here earlier, Senator Russ Huxtable, who I'm not sure if he's still here, also Senator Kyle Evans-Gay, who's running for Lieutenant Governor, was here earlier, and former Representative Ruth Briggs King, also running for Lieutenant Governor. So there's a lot of interest on the part of our leaders and our incoming leaders in this issue. So I'm particularly excited to hear from our next panel on advancing care through workforce development, implementation, and innovation, moderated by Rita Landgraf, who hardly needs an introduction in this room, but here goes. Rita is the owner of Landgraf Consulting, doing work with clients like the Behavioral Health Consortium and the SCAN Foundation. She serves on the Delaware Prescription Opioid Settlement Distribution Commission and the Professional Studies faculty of UD's College of Health Sciences, and provides customized strategic leadership support to the Healthy Communities Delaware team. From 2009 to 2017, Rita led Delaware's Department of Health and Social Services, working tirelessly to drive signature initiatives in the Markell administration, improving mental health services, expanding home health services, bringing persons with disabilities into the workforce, and taking a whole community approach to healthcare policy, striving to address social, economic, and environmental challenges so that no one was left behind. Over the years, she served in countless leadership and board positions with organizations both national and local that are way too long to list here in the time allotted, but let me say that as someone who has now served 4 governors, I've come to appreciate that every administration has its worker bees and its rock stars. And Rita is that rare combination of both. The proverbial real deal. Ask anyone who has served with her, and most of you here have today. Her energy, her empathy, her creativity, her motivation are unbounded, and Delaware and the nation are so much better for it. Rita Landgraf.
Thank you. Thank you. Hi, everybody. Thank you, Rick. That was a fabulous introduction. I'll keep that in my heart. It's just that Rita is an older woman. She says it proudly, and indeed have benefited from the wonderful state of Delaware, both in my public service engagement, but also just in the engagement that Delaware brings. Being a small state with all of you in this room, I'm sure I know many of you personally, and I am grateful for that. I'm so excited to be a part of not only today's work, but for this panel in particular. And thank you, Tim and Kathy Matt, for recruiting me to really moderate this esteemed panel they're going to continue this dialogue that we've been kind of thinking about all morning, but also from very diverse lenses. And that's what we wanted to bring to you. The focus for this panel is, of course, the continuation of workforce development. And I'm going to ask each panelist to reflect upon what they believe are the gaps in the workforce, in their specific areas of interest, and then, of course, the gaps that we have in delivery of care. In addition, I want them and you to be thinking about, as you listen to what they have to say, about what are innovative ways to address those issues. We heard innovative ways in the previous panel, but also when you think of the subject matters that they're going to be bringing forward, what stimulates your thought process? And we're actually going to do this. I'll pose a question for all the panelists, and then I'm going to pause and that you come forward rather than waiting to the end with each of these questions. Now, to get started, panelists, I want you to frame what the current landscape is in the work that you are doing. But before you do that, I want you to introduce yourselves. Many of you, I think, are known by everyone in this room because it is Delaware. But you might want to just reintroduce yourself and what brought you to being a panelist today. And I'm going to start with my dear Senator. Not to throw you off, Senator, but I'm sure you're used to that, seeing that you're a senator.
Thank you. So I'm State Senator Spiros Mantzavinos. I think I am the only one here without a medical degree or something of that sort, but I am a caregiver. I'm also a state senator. And I want to thank everybody in this room for the work that they do. I know it's been particularly, you do challenging and hard work every day. The last number of years was even harder. So from my perspective, I want to thank you. I represent the 7th District in the State Senate. That's the Ellesmere-Newport area. I chair the Banking, Business, Insurance, and Technology Committee. So you're wondering why I'm here. Since I got elected in 2020, I've spent a lot of time focusing on elder care and aging issues, both from personal experience with my mother, but also from almost immediately when I took office, hearing from constituents about this issue. Now, I realize, again, 2021 was a particularly challenging year, but I think many folks brought their experiences prior to the pandemic. As a result of that, one of the first things I did, working with State Representative Krista Griffith, was create and co-chair a working group on aging in place. I think we can all agree that it's best for people to be in their homes for as long as possible. And that was, again, something that was started as a result of working with former Representative Larry Mitchell, and then also creating a task force on long-term care and memory care. That's where I think I've worked to touch base with a lot of you in this room. I'm currently also, as a result of that, we're continuing that with Representative Kendra Johnson, having created a caucus on aging. I'm going to make sure we phrase that right. It's a caucus on aging, not an aging caucus. But again, this is something that we've begun, and again, to keep the focus on what I'm going to call, and I'm sure you've all heard, the social determinants of aging well. So I'm happy to get into some of these other topics as we go on, but I appreciate the opportunity to be here.
We appreciate you being here. Next up, how about if we go with Dr. Stinton? I think if you just use it, they might be able to, yeah. The magic is back there.
I have 2 degrees. I can't work a microphone. Sorry. Good morning.
It all
My name
works.
is Christine Stinton. I am the Chief Dental Officer for Lorette Health Center. We are the FQHC in Sussex County, and we have 3 sites, Seaford, Georgetown, and Milford. And I'm also a member of the Data Board, the Delaware Institute of Dental Education and Research.
And give us a little bit about the landscape question. Does the landscape look like, especially in the work that you're doing, Dr. Stinton, relative to dental? Because many times my experience, as we even think about workforce development, many times the oral health is not really at the forefront, but yet oral health is so significantly important, not just for how we look, not just for nutritional purposes, but also for our overall health. So give me since I am not a dentist, give me your thoughts on the landscape right now from a workforce development perspective in dental.
I am fresh from the NOAA conference, the National Network of Oral Healthcare Access. I just came from there this morning, and all we did talk about was oral healthcare and serving communities and the lack of oral health care, the workforce that we're trying to grow and develop and retain, dental hygienists, dental assistants, and dentists. I think having come from the state of New Jersey, where there just are so many people, so many dentists, dental schools, dental residencies, that there's a plethora of dentists coming here, it was almost a shock that there are so many underserved people, especially in Sussex County where I live and work, that it was a complete contrast. And what I'm finding living here, working here, seeing the building, seeing the amount of people come to the state that have realized how wonderful it is to live here and leave from where they come from in the past, that the amount of people coming doesn't equivalent to the amount of physicians, dentists, and specialists. What I've seen overall is the barrier to healthcare, it just doesn't seem to fit with the amount of people. I might not be as familiar, but I'm listening to the medical profession and their needs, but dental, our hurdles are without a dental school, without a dental residency, without those advantages that could bring more residents, more interested people, more retention to the area, especially in Sussex County. Without that, I think we're at a disadvantage. And having taken the exam that this state asks for, that no other state asks for, that's still a barrier in some people's minds. Although the state has come a long way and a lot of people have done a lot of work to make the community health licensure available to dentists, to increase the amount of dentists. It just took a long time for that. And having come from academics, I was teaching at Rutgers before I came here. When you say the state of Delaware, the first thing that comes to mind is that exam. And it takes a long time to erase history in some people's minds that there's other ways. And I still talk to my colleagues, and I say, please tell your students, talk to me anytime. There's other ways to get into this wonderful state. We need dentists. There's loan repayment. There's so many options, but it's those historical barriers that are sometimes in people's minds.
Thank you for coming to Delaware. How about if I go down to the end of the table? And Mark, as you introduce yourself, also kind of give us, from your perspective, what is the landscape with the work that you're focused on?
Sure. Thank you. Hi. Excuse me. Good morning, everybody. My name is Mark Thompson. I'm the Executive Director for the Medical Society of Delaware. I want to thank Tim and others for putting the event on this morning, and I'm honored to be on this panel this morning. And I want to thank all of you for taking time out of your busy schedules to be here. I know many of you in this room, we work collaboratively in many different facets in this community, so it's the fact that this many people are here, you all are here, thank you very much. So, as I mentioned, I'm the Executive Director for the Medical Society of Delaware. The Medical Society is the professional society that represents physicians across the state, that whether they be employed or whether they be in independent practice. Let's see, we have over 1,300 members with the Medical Society. That includes retirees as well as residents. So we represent the physicians through a number of functions. One of the largest ones happens to be in the legislative advocacy arena, but we also help them with functions in communications. We are nationally accredited to provide Category 1 CMEs. We have a very active physician relations program, and we have, we have 2 nonprofit foundations and 3 for-profit entities that also help to make the medical society work. We're very much of a physician-led organization and very blessed that I've got amazing physician leadership, but I've also got an incredibly dedicated team at the Medical Society, and we couldn't possibly do it without that combination of dedicated physician leadership and a solid team. So I come at things with a perspective of I have over 30 years of healthcare administration and management policy experience. I've worked both in the hospital and healthcare setting. The last 13 years, I've had the pleasure of being with the Medical Society. So of that, going on 8 years as the executive director. I tell folks I get this work very honestly. My father was a surgeon, my mom was a nurse, and so I'm also living proof that physicians and nurses can get along quite well. So, but in this day and age, with the complexities, the stresses in the system that everyone on the team faces, we do have to figure out ways to collaborate. We do have to work together. But also, it's great to be able to work with Senator Mantzavinos and others in the General Assembly, which we do on a regular basis. And it's the issues are both at the state and federal level. A couple things where it makes the issues very challenging for the physicians is just the concept of physician burnout and fatigue. It is very real. It is very quantifiable. And love to be able to talk to issues, what we can do to help alleviate that. It's true for nurses, PAs, and everyone else on the team. But the number of physician suicides is up, again, sadly. We just had Physician Suicide Awareness Day. This is Suicide Awareness Month. So anything that we can do to help with the environment. I think Delaware is an amazing state. But yet we have our challenges, hence why we're all here. But with those challenges come opportunities. And whether they be through legislative initiatives, whether they be through economic development opportunities, and or working jointly with state and federal, I think there's a lot that we can do and we can talk about on this panel more. But again, thank you all for the opportunity to be here.
Thank you, Mark. And last but not least, but actually she's not really last, because just so you'll see Representative Minor Brown, our House Majority Leader, running through the door, coming from another meeting that she is attending and will be joining that panel. So Kathy, I didn't really save you for last, but you're almost last to share with us who you are and also what you think in your work right now is our landscape in workforce development.
Thank you very much. So I'm Kathy Matt, and actually you'll notice, of course, that I'm not on your program. So I'm representing, in part of my comments today, Valerie Longhurst, because she is a great example of how we have combined legislators with clinical people, with educational institutions, all to come together to bring about enormous changes. And when I speak about that, it really is about the speech pathology program. And I'll come back to that in just a minute. So I should give you a little bit of my background, I guess. So as you heard mentioned already, right now I am very fortunate and honored to co-chair the Health Workforce Subcommittee, which reports to the Delaware Healthcare Commission. And we have many, many fabulous people on that healthcare subcommittee. And I really am grateful to that group. Can I have everybody please stand up who's on the healthcare subcommittee? So Tim Gibbs, Chris Otto, Nicole Moxley, Rick Geisenberger, Maggie, Cheryl Kikes, and I think there are many more that have come in and out of the room. Because as everybody, and actually Mark and I think the senator as well spoke to this as well, I mean, everybody in this room today, you are all extremely busy and you're here because you're concerned about workforce. And so thank you for taking time out of your very busy schedules. And I'm sorry for the patients and families that you won't be able to see today because you're here and hopefully somebody else is taking care of them. So I really appreciate all of the work that's happening on that committee, and just so grateful for this summit today to talk about some of those topics and all the work that the Delaware Health Force has been doing to gather the data, to look at what our health professionals look like, and then really the more challenging job is to think about where we're going in the future, and that's why we're here today, to figure this out. So I do that, and then one of the other hats I wear right now is that I'm chair of the Dimer Board. And that actually is also another board that very excited and very honored to be chairing it for right now, although we have some legislative changes that just have been approved, and we're adding some new people to the Dimer board to really give it some even more strength, and you'll be hearing about some more of that later.
Can you tell us what Dimer stands for?
Yes, so Dimer is the Delaware, I'm a native Delawarean, and I'm an undergrad, did my undergrad at UD, so I think everybody knows what Dimer is.
But
So it's the
maybe
Delaware
people don't.
Institute for Medical Education and Research, but you're right, thank you for correcting me. But it is very powerful in terms of being able to partner with Jefferson College of Medicine, which is now Sidney Kimmel, and I'm showing my age by calling it Jefferson, I guess.
We
And
love
then-
that. We embrace aging.
Yes. And then, so I'm interested in all the things you're doing, Senator, with your aging population. And I actually now work with Jenner's Pond as well, bringing all kinds of seminars and everything to some of our aging communities, even over the border of Delaware. So it is a very powerful group, and in addition to Sidney Kimmel, we also work with Philadelphia College of Medicine. And you heard this morning in the panel some of the discussions about medical students being here, but then also getting our Dimer students to return and do some of their training and the increases in the residency program. And so the Delaware Health Science Alliance, I was the director of that when it first started in around 2009, and then we turned it into an LLC, and now Dr. Omar Khan directs that with Pamela Gardner as executive director, and they're doing a fabulous job to also work in partnership with the Dimer board to really enhance the return, hopefully, of some of our students back to Delaware. So then, before I did this work, I was actually the dean of the College of Health Sciences at the University of Delaware for about 14 years. And so as you talk about creating pipelines and educating a workforce, that was what we thought about every single day. And the dean of the College of Health Sciences now, Bill Farquhar, Dr. Bill
Stand
Farquhar.
up, Bill. Stand up and wave.
Please stand up, is here
Come on,
today as
stand
well.
up.
And so again, one of the lenses that I will be speaking from, and you as well coming from academics know so much, the challenge of not only educating them in, as you say, classrooms, although another thing I want to bring up today is simulation as a bridge to clinical training and work in the hospitals as well as in the communities and everything. So all of that, we've got to bring everybody around that same table together to really talk about how do we do this, because as much as it's a challenge in the clinical site, it's a challenge at the educational institutions as well, because this type of training, it's expensive for the students, it's expensive for universities as well. And we try to keep tuition low so that the students don't get that increased burden. So, I mean, if I've heard anything this morning, it's about pulling all of those pieces together and getting everybody around the same table so we know what the burdens are at all of those different, what are the pinch points, and how can we work on that together and leverage our resources together to really come up with some great solutions.
So one thing I want to say about this panel, as you can hear, they're all ready to go and talking about how do we advance that level of collaboration. And just as Mark indicated, how a nurse and doctor came together, and now we have Mark. Look at the value of collaboration, right? Keep that in your mind, like the sky's the limit there, right? We're like, wow. So Christine talked a little bit about the barriers from the Representative Minor Brown, come on up. Welcome. Our House Majority Leader, doing fabulous work. Not that I'm putting you on the spot, Mimi, but I'm putting you on the spot because I know you can handle it. Representative Minor Brown, we were just going through introducing ourselves. Even though probably everybody knows everybody, we wanted to give each panelist the opportunity from their own lens to tell us who they are, rather than me telling everybody who you are. You know yourself best. And what I also would love from you is also to frame the current landscape. And I know I'm like, you're good at multitasking, so I'm just, yeah, I thought I was like going a little too. I want you to introduce yourself and kind of, you know, what brought you to us today, and frame the current landscape that you are working on relative to workforce development. So you ready? You just pick up the mic, and the men in the back will make sure it's on. You don't have to play with it or anything.
I think it's on. Good morning, everyone. I am Melissa Minor Brown, State Representative, House Majority Leader. I represent the 17th District, but I represent the entire state of Delaware. And I'm a nurse by trade, and let me see, that's enough about me. I'm a member of the Delaware Healthy Mom and Infant Consortium. I had the pleasure of co-chairing the Social Determinants of Health Working Group with the amazing Rita Landgraf, and we did some good work there, and I'll probably talk about that a little later because it impacts our workforce. And that is about it. So you asked me
Current landscape.
Current landscape, what are we doing? What initiatives are we doing around the current?
Just give me what the current landscape looks like.
Around workforce.
Around workforce, like, you know, even your work in child and maternal health and some of the opportunities that were there for you to do some advancements. And don't forget also, because education has come up a lot this morning, don't forget the other hat that you wear too. That
Okay, yes.
You want to share.
I also am the Director of Clinical Operations and External Relations with the University of Delaware School of Nursing. And so when I think about our current landscape around workforce, we're really struggling right now when it comes to healthcare. And even looking at HRSA data, because I am a nurse, so I like to talk about evidence. I like to rely on data. Data always tells the truth. And even HRSA has said that Delaware, Kent, and Sussex County are a full shortage area when it comes to healthcare access. And that is healthcare providers, full scope. I'm talking MDs, OBGYNs, nurse practitioners, nurses, just everything, mental health providers. And then Newcastle County is a partial shortage, but that's still concerning. So I think right now we really need to think about how we address that, and we need to prioritize it because it's only going to get worse. I don't know if there's any Bay Health folks in the room, but I've heard.
Yeah, Bay Health, come on, woo!
Where's Bay Health?
Bay Health
Okay.
is here.
So, and Bay Health, not to put you guys on the spot, but I mean, I'm hearing that soon you will no longer have the OBGYN offices available, and I'm sure it's not your intent to just shut down women's health, but you have to have the providers to support it, and we don't have that. In the legislature, we've done some work around just promoting or a way to enhance the workforce and also make it more diverse. We just worked on legislation around Dimer. I think I just saw Kathy right here. And included in that is also ensuring that we have a more diverse workforce. But we also have to look at how we keep people here in our state as well. How do we make it appetizing for people to want to stay here? And also around women's health, we just passed 2 resolutions, one to reach out to our higher education institutions and kind of, promote them to, encourage them to open a med school here in Delaware, right? So Delawareans can attend med school and hopefully stay in Delaware. And also midwifery programs, because we know that access to midwifery, access to doulas, significantly reduces poor maternal health outcomes. And so how do we increase those providers in our state, and how do we keep them in our state? We don't have a midwifery program in Delaware, but we need midwives. I will talk about, let's see, I touched on that, but there was something I was going to say, and I just forgot, and it was important.
It'll come back to you.
It will come back. Want me to
yeah.
stop here and you come back to me?
Yeah,
All right, good.
absolutely.
'Cause you know I'll
I
keep
know
going.
it'll come back to you. So, Christine, when she did her landscape, she did bring up some of the barriers from a dental perspective relative to, especially in our state, and some of the barriers that you did say are getting better. Relative to attracting dentists, and similar to what we've heard relative to a medical school, we do not have a dental school. So some of those barriers. Christine, is there anything more you wanted to add to the barriers relative to workforce development and the dental community? And do you want to explain, because I believe, are you a member of DIDER? Do you want to explain, do you want to first tell them what DIDER is? So we have DIMER and DIDER, right? I don't know, we might come up with another before the end of the day. Just a thought. Dimer, Dider. I don't know, Tim, you got to change the name of your workforce. Something like that. Diaper, I don't know. Okay.
DIDER is the Delaware Institute of Dental Education and Research, like medical. It does a fairly good job reaching out to Temple University, where I went to dental school, and collaborates with keeping Delaware residents from here who attain spots at the dental school and bringing them back. They also work with the Christiana Residency Program. They're branching out to University of Delaware to reach to undergraduate students who might have an interest in dental early on, and how to get a pathway for them through the proper program to graduate and then consider dental school. And then I think they're also reaching out to Del State or Del Tech. I think the collaborations are beginning, coming from NOAA and listening to other states, bigger populations, bigger resources. The key, it seems that the collaborative efforts between county and communities, or educational institutions and the individuals, once those barriers that exist because the contacts aren't there, once the resources are established and the efforts are made and the relationships are completed, I think retention begins. Like some of the FQHCs I was in contact with over the last couple of days seem to have good connections with the county and the educational systems within their environment, and then they're able to pull in resources and keep young students in and retain them, and they have programs within their FQHCs or community health centers to help them promote to higher positions to make retention even greater. But it has to start, I think, within the community. I think there's a lot of great efforts. I don't know what it takes to kick it off and keep it going, but I think those barriers are easy to knock down, but that's, for the forefront, that's what I see so far.
That's fabulous. Senator, barriers that you're seeing that you want to address in advancing the workforce. You know, you brought up the wonderful, well, one thing we all have in common, everybody, do you know what it is? We are all aging.
Yep. Well, let me build on that. I mean, I did not really get into the landscape perspective earlier, but I think it's something that we have to acknowledge. I think we all kind of think about it and talk about it, but Delaware's population is, and continues to age. We're getting old. And it's diversifying as well. That's the reality. And I'll be the skunk at the picnic on this, but you know, if you saw Bankrate rated Delaware the #1 state to retire in, I know some of my colleagues thought that was a wonderful announcement and pronouncement and all that, but I think we need to pause a bit here. You know, and again, I chair, as I mentioned in my introductory remarks, I chair Banking, Business, Insurance, and Technology Committee. I'd like to see the state being #1 as well, you know, for attracting new businesses, you know, life sciences, you know, creating the jobs. Because as we look at what this population brings, you know, and it brings a lot. It brings, you know, energy. It brings new people to Delaware. It builds our volunteer workforce, you know, volunteer groups in the state. But it also takes away from personal income tax. I don't know if Rick
Yeah,
Geisenberger
is
still
Rick
here.
still here?
He probably slipped out here. But,
Yeah.
but I think we have to look at these sort of things. And when you think about the impact that these sort of things have to our state budget, when it comes to Medicaid, when it comes to, you know, what our state contracts are looking like for providing services as well. So there's a lot that goes into the landscape, and I think when you start thinking about the barriers, we have an aging workforce too. I think, you know, we have to address that. How do we start to get, you know, people into, and I'm going to particularly focus on the elder care population, because I think, and again, from a caregiver perspective, that is the most challenging. You know, and let me be clear, the aging population is not just in eastern Sussex County. Granted, you know, it is the fastest growing county and area in our state, but if you look at some of the projections that come out of the University of Delaware, you know, by 2050, in Newcastle County, 43% of the population will be 50 and over. And we are just growing rapidly in that situation. If you look at some of the trend lines, it's not good. So we really have to realize that, number one, where is the aging population, and where do they need services? The highest concentration, again, is northern Delaware, north of Wilmington, and in Sussex County. So again, if we get back to some of those issues around the social determinants of aging well, it's not only just healthcare, but how do you ensure that as folks age and perhaps they're here from another state and they don't have family, what is their transportation situation? What is their nutritional situation? What is their ability to combat social isolation? So there's a lot of other factors that go into this other than direct healthcare that are going to affect the workforce. There's also a cost factor. Again, I'm going to have to get back to that. You know, there's a cost to the state, but there's also a cost to the individual. I mean, many of these services are private pay. They don't fall under Medicare or Medicaid, perhaps. There's stigmas attached to, unfortunately, with Medicaid still. And, you know, we have to address that this is a fact for Delaware. I also think that something else that affects not just the workforce, it's just as caregivers, this is a very emotional issue. I think everyone I've run into has a story about either that, you know, that they faced with an aging parent or aging relative, or know someone who has an aging parent or relative. But people become flummoxed very quickly. Very smart people become flummoxed when it comes to dealing with elder care issues and how you treat or how you start to care for somebody who's aging. And then there's sticker shock that comes with with it as well. So I think, you know, as we look at barriers, it's obviously, again, the direct care, you know, do we have enough specialists that can address gerontological issues, neurological issues? Do we have enough people who are trained and ready to deal with the physical disabilities that come as people age, either in the home or in a facility or in a healthcare setting? Likewise, Alzheimer's and related dementia. There's, you know, right now the Alzheimer's Association projects a 21% increase in individuals with Alzheimer's and related dementia, and they have unique needs as it relates to the demands on caregivers and the healthcare workforce. So how are we going to look to address that? This is not easy work. It takes a special person to be in this field, I believe, and obviously we need to do what we can to either, you know, continue to support and encourage people into this field. So again, we're facing demographics here, and while we look at the whole workforce continuum here, this particular area is going to grow as long as, again, we're seeing influx of retirees from out of state, but also, again, our own native population that is aging. And so I think I touched on a lot there, but I mean, I think it is all interrelated in terms of the landscape, but also a lot of times the landscape, and I think in this area is also, you see the barriers as well.
And I also appreciate that you brought up the caregiving population, the family caregiving unpaid workforce. And, when we think about the aging demographic, I used to say when I served as secretary, if all the family caregivers went on strike, the state wouldn't be able to even pick up a small portion. So just thinking about that too, and how do we keep our family caregivers healthy and supported as well. Mark, the senator had a lot in there that made me think about the medical society and what you heard, not only we're seeing shortages across the workforce and in multitude of disciplines, but, I think he also touched upon specialty care and how do we advance that to address, our population base.
Right. So, no, I think there's, I wish I could also, you talk about aging. I wish I could say that Delaware's physicians weren't aging, but the reality is they are. To try to get those physicians backfilled is going to be a challenge. And, I think with the advent of the residency programs here, I think is a wonderful, wonderful thing. But I think we have to look at, so you get the aging physicians, you got a shortage of both primary care and specialist. I think everybody in this room has experienced that in one form or another. And then what's also leading to that? So, because when those physicians, either when they age, they either retire because of other issues here in the climate in the state, which I'll touch on, but they're either leaving the state or they're closing their practice and becoming employed. All of these things make it harder for all of us to access care. What are some of those issues? Here in Delaware, and I say this with all due respect, as I'm literally in between the House and the Senate. So, but we do have I know. So, hey, I know, no, but we have a robust legislative and regulatory climate in the state when it comes to physicians. But we also do some great work too. So with my esteemed colleagues and panelists here. So, but what else we have to look at in the state? Many of the younger physicians are coming out $250,000 to $300,000 in debt. Okay, that leads to, especially in some parts of the state, affordable housing problems. So that's a big one. Also, when you look at, so I'm from the days of both working in the hospitals and as physicians are contemplating coming to Delaware, if they have young families, they want to look at the quality of schools in the state. And unfortunately, the public schools ranking is around 45th or 46th in the nation for quality outcomes. Again, there's a great opportunity
Say
there.
that again, Mark. What is Delaware's, what do we rank?
They're around 45th or 46th in the nation in quality outcomes. That's tough when you have physicians who, again, with children, want to know what's it going to be like for education for their children. So that's a factor along with the housing. There's, when you look at other issues, when it comes to reimbursement for physicians, let's see, let me take a look here. According to the Medicare physician payments, when adjusted for practice costs and inflation, have declined 29% from 2001 to 2024. Again, declined 29%. That is a real problem for both primary care and specialists. Now, we've tried to do some work here in Delaware through legislation with Senator Thompson and former Representative Dave Bentz, who I actually see walking back over that way right now, on helping with primary care reform and access
He can
to
still
care for
help with that
Delawareans.
too. He can still help with that.
So,
David.
and we are still continuing to do work there in that legislative arena. So I don't want to make it sound like it's all doom and gloom, but there's a lot of work that we can do, whether it's through, again, economic incentives, increasing, the student loan repayment programs, being creative with mortgage assistance and others.
So those are the opportunities to intersect with those barriers, is what I'm
Because you know me,
hearing.
I'm glasses a half full kind of guy. So
Well,
I'm not
no,
gonna
that's
just
what,
stick
well,
on
that's
it.
what
Yep.
we all need, right?
Yep.
Like we could sit here all day and talk about how Debbie Downer, how awful it
Right.
is, and right.
Yep.
But I think everybody in this room kind of lives that in some way. I mean, we're all consumers of health, right? So we live it in some way. So I want to kind of now move us where you're going, Mark. Like, how do we advance the opportunities to address these barriers? And, these barriers are also on the national front.
Right.
Michelle Washko talked a lot about that to lay that framework. But here in Delaware, we're small, but we're mighty, right? So how can we start taking those barriers? Like whenever you see a crisis, there's usually opportunities within those crises.
Right. So, I think, to touch on that with, again, loan repayment programs, which the state has done some good work there, and also additional scholarship programs. I think there's also opportunities to increase our workforce by looking at the Conrad 30 waiver program. And I sit on the state's J1 visa board. And that board does a lot of great work, but we get basically 30 slots a year, but we have many more requests than that. And that's also part of a federal challenge as well. But when you
Can a
look,
state locally increase that?
no, we cannot.
Okay,
That's a
so that-
federal thing. But on the state side, where there's opportunities, or there are unmatched residents out there. And I think Delaware could do a great job to help recruit some of those unmatched residents to our new residency programs. I think also we do have a number of international medical graduates who are in Delaware, but their skills and their education aren't being tapped and utilized to the fullest. And I think there's some opportunities there that we could do things. And again, I big on economic development opportunities. I won't give you all the numbers, but so the AMA, American Medical Association, does a 50-state and District of Columbia economic impact study of physicians in every state. And I think there's a tremendous opportunity for Delaware to embrace the physicians as more of an economic engine and driver in our state. So I could go
So
on
I think
and
that
on,
was,
but-
I think Mark, is starting the positive list. So everybody start your positive list. And if something resonated with what you heard, and other panels or other panelists will or have their positive list, if something resonates, think about that collaboration, right? And we're so fortunate we have two legislators on the panel, but we also thank you for those who have joined us from our General Assembly, because no doubt some of these things will take policies, right? And it's not all on you to create those policies, it's on us to create them with you. So, Representative Minor Brown, did you remember what you forgot, and I gave you some space to remember?
Well, you know what? I can talk about it here, actually. So I think it's really a multifaceted approach to really uplifting our workforce. And for me, I really want to just kind of dig into how we uplift Delawareans, right? Because that's who we want in our workforce. We want Delawareans. We want them to stay in Delaware. We want them to live in Delaware. We want them to love Delaware. And there's two things that I'm currently involved in that I can talk about. And one is looking at educational collaborative partnerships, right? So I'll talk about something that the University of Delaware is doing right now. They have a academic practice partnership with Bay Health. And it's really amazing because we're tapping into our Delaware students, our local students, and we're saying, hey, Do you want to be part of this amazing opportunity where you'll be considered our academic scholar, right? And we're going to give you an incentive to be in this program where you will, while you are in school at the university, you will also receive an internship with Bay Health Hospital. So you are working within the hospital, you are working with the preceptor, you are being trained for your future job, and you're saving money while you're doing it. And so that leads to job retention, and it also allows them to get the training that they need, because one thing that we are seeing a lot is we're seeing newer nurses, they're coming out of school and they're kind of bouncing around in different places, you know, and if we really stopped and looked at like all the near misses that are probably happening when that happens because the nurse is not staying put to be able to really gain the skills that she needs in one space, and there's a lot that comes from the burnout and the stress and being stretched too thin, and it's a double-edged sword, right, because we don't have the workforce to support, so you're going to be stretched too thin, and you're going to get burnt out, and you're going to leave, and so we kind of have to look at it from that aspect too. But Bay Health is doing amazing with this partnership with the University of Delaware, and this is going to retain our students. Our Delawareans are going to stay here in Delaware. They know they're going to have a job when they get out, and they're going to continue, and they have created a pathway for them to continue on through their undergrad to their master's to their doctorate, and I mean, I just think that's an amazing opportunity. So shout out to Bay Health and to the university for this collaborative, for this partnership. But also, when you think about, and Spiros said it, you know, he talked about the holistic approach, right? And for someone to even be able to be successful in an educational program, you have to be secure, right? You have to be able to have a place to live. We have a housing crisis. You have to be able to have access to healthy food. You have to be able to have childcare. You have to be able to have the time. Can you go to school and go to work? I myself struggled through that, right? Like as a young single mom, just trying to get through school to even be a nurse to get to a point of sustainability. And so when I say focus on data, the work we did under the Delaware Healthy Mom and Infant Consortium, and I'll have to talk about this UBI pilot really quick because it was amazing and it had great outcomes.
Tell them what that means, UBI. What does that mean?
Okay, so it's guaranteed basic income, right? So literally when we knew we had a maternal health crisis as well here in the state, so we looked at one of our worst zip codes in the state, which was 19802, and we took 40 housing unstable pregnant women. And we said, how can we pour into these women, offer a hand up, and really these families, because some had spouses as well, and get them to a point of sustainability. And so we literally wrapped our arms around these 40 housing unstable pregnant women, and I call it like unpacking the backpack, because we also have to figure out how you got to this point where you're housing unstable, and we got to kind of just unpack that backpack, right, and just get you to a point of sustainability and just address the barriers that exist. And so these women, we ensured that they had the maternal health care that they needed. We offered them a stipend of $1,000 a month for 2 years. We ensured that they had secure housing. We ensured that they had the wraparounds that came along with it. There was a case manager involved, social work involved, behavioral health involved, access to education, financial literacy, all the things to get this person to a point of sustainability. And right now, the last group of women are actually coming out of this 2-year pilot. And I got the opportunity to sit down and talk to a group of the women in the pilot, and it was like life-changing. Literally, when you invest on the front end, you literally win on the back end. There was a 320% return on investment by dumping into these women, pouring into these women for 2 years. And yeah, it cost us some money. It was about $500,000, something like that. But the return on investment was 320%. I had conversations with these women. This one woman went to school, got a certification, saved her money, had a down payment for a house, had a healthy pregnancy, went through the behavioral health piece that she needed to ensure that the barriers that got her to the point of housing instability were no longer in her pathway, and now she is at a point of sustainability and has certification in healthcare, and has housing, and has a healthy child, and has a healthy mind. So when you invest on the front end, the return on investment is literally saving lives, and we're reinvesting in our state. So I just want to say we have to also think about how we can reach down and lift up some of our Delawareans so that they can get to a point of sustainability, and it's also impacting the workforce as well.
Yes.
And thank you for your help on that, Rita, because
my
you
honor.
were a part of that
It was
pilot.
my
But we
honor.
have the data now, and that's what we needed. We needed the data to show that we can literally significantly impact the workforce, the economy, and all the other things, right? Because housing instability, no access to health care, it leads to what? Multiple ER visits, which is going to cost the state even more money. Even more money. If you don't have access to the financial literacy, if you don't have access to the behavioral health care, we are doomed.
And
But
a strain
it
on the
works.
workforce, too.
Right, and it's
There's
a strain on the workforce. So we know what works.
Right.
We just got to do it.
Right. So I love how you weaved in, some of the most vulnerable of the vulnerable, because if we can figure it out with the most vulnerable, all of us benefit, right? If we can create that type of a pipeline that supports the most vulnerable of the vulnerable, we actually all benefit from that. So I love that you did that. I also wanted to remind, because when Bay Health and UD came together, you made a mark, right? When the doctor and the nurse came together, Mark's parents, they made a mark. So you made a mark. When UD and Bay Health came together. So we can make marks. Think about it. Like, I want you to remember this when you leave here today. How do you make a mark? That's the way we go. All right, before, Kathy, I'm going to come to you, but before I have you weigh in, if anybody's thinking, as we're having this dialogue, because this is your session, like, please just come up to the mic, right? We want to get away from the Debbie Downer part, and we want to go to innovation. So as you're writing down, like, what is the innovation? And while you're thinking of innovation, like, follow the magnificent Mimi Brown, right? Because that's what she came to the table with for that most vulnerable population. So I don't see anybody jumping up. Come on, let's make a mark. Kathy, let's weigh in. Oh, I'll get to you after I got to go to Kathy first, but thank you for jumping up. I was looking over here. I needed to turn my head. Thank you. Stay right there. Don't you move, Kathy.
So I just want to make a quick comment that actually will pull this all together, coming back to the Bay Health issue, but also not issue, but the partnership,
mark.
because it's about something that was mentioned earlier, right? Is that necessity is the mother of invention, and in a crisis time we come together. And so when Mimi was talking about the partnership, I'm sorry.
No, I called her Mimi too. The magnificent Mimi Brown.
She was my faculty at one point when I was the dean. So, but I remember very distinctly during COVID when President Asanas came to me because the Governor Carney had come to him and said, can you graduate your nursing students early because we really need them in the hospitals. And of course, I talked to our nursing faculty and they were like, there's no way. And I said, agreed, we cannot do this. But I said, our students need to go out and do clinical rotations. And we also, in addition to our nursing students, we have tons of other students, pre-med, in all different areas across all different colleges that need and want experience in the hospitals, and they will go in as volunteers. And Bay Health was one of the hospitals. Some of the others did as well, but Bay Health, you really came to the table and said, we'll take your students. And I'm bringing this up as a very good example because you accelerated the process whereby those students could be cleared in order to work in the hospitals, and then came in and then said, well, you're volunteering, we're going to pay you for doing some of this. And then this is how that partnership came about. So I think sometimes the experiences that we have that are real challenges are the ways that we then lead to the innovation that we can do. And so we were also So having challenges with clinical rotations, as you heard about today. And so just one thing I want to bring up, because I know we have a lot of other questions you want to get to. But we develop simulation, as many of the hospitals have done as well, have developed simulation experiences, and we have the ability to have this healthcare theater, so we do high fidelity simulations. And the Delaware State Board of Nursing then cleared us to be able to have 1 hour of simulation equal 2 hours of clinical. That just helps our learners to get more of those experience so that when they are then going out to their clinical sites, they are better trained to do that clinical piece. But again, so it's those tight points and those bottlenecks and those touch points. And so I think just getting everybody together and really developing these solutions together is really important. But again, out of that came the partnership and then the way to pay students while they're still going to school and bringing more students through. So really, really grateful for those great ideas across the board.
Thank you, Kathy. Now I'm going to go to my audience.
Hi.
Hi.
My name is Nancy Brohan. I'm a licensed dental hygienist, definitely in the minority here. Native Delawarean, 52 years licensed hygienist, had to go out of state for education because it was not available in Delaware at the time, since I'm part of the aging population. Retired, but as you see, my both feet are still in. I was able to use a state grant because I went out of state to an institution and gave a 4-year degree. So I was educated, and I don't like to bring up that it was cheaper to go to WVU than it was to Temple. I got a 4-year degree at WVU, where at Temple would have only been 2, but that's beside the point. I want to thank you, Dr. Landgraf, for your comments on oral health. We like to say the mouth is connected to the rest of the body. That's where the medical comes in. Dr. Stinton for the realization of the dental workforce. And Representative Minor Brown, I was happy to give testimony at your bill in 2019, I think it was, the child's drink bill. Right. That was very happy to run to Dover, cancel patients, and be able to run to Dover to do that. Today's concern of workforce, and I'm speaking for myself as a dental hygienist in Delaware, not representing the Hygienists Association that I am a president of, but as many of you may know, you may not know, the dental program that is, Deltech has a program with 2 campuses. The Dover campus has lost its clinic. It's going into the 2nd year now, which resulted in the class size being cut by 8 students. The students who now are at the campus in Dover have to drive to Wilmington to use the clinic. Deltech is working on it. Deltech needs help, our legislators. This is coming from me. It's not coming from Deltech. Bay Health, or are you anywhere? Okay. That is a great concern. There's been a workforce across the country. Delaware is up. We have a Facebook group. It looks like an employment page. We need help. We need temps. We need this and that. It's always needed for hygienists in Delaware, and also assistants and office staff as well. And it's really humbling to sit at national meetings as a hygienist to hear Delaware being the only state. It's a little better when we're doing Zoom, but we're in person, and they know you're from Delaware, and everybody turns to look because of the exam, as Dr. Stinton mentioned. There is currently a dental hygiene compact license. Delaware has compacts in, I believe, every other compact that is available, nursing, medical, for license. And Delaware, it would be available. It has passed 10 states in the country, and there's no legislation currently.
So that would require legislation?
Yes, it would. Yes, it does. Yes, it does. And
all right,
also,
legislators.
and I have to slide in here that Delaware happens to be the only state that dental hygienists are not licensed to give local anesthesia. Just going to drop that there. Thank you for listening. I'm here all day.
Thank you. You gave us a lot to think about. Anybody, Christine, anything you want to add or anything? Are you good? You're welcome to.
I agree with everything
She
you
agrees.
say.
Yeah.
I pray every day that my 3 wonderful hygienists who have been with me almost 4 years do not leave.
Yes.
I echo their sentiments when they felt that their school closed. It's a lot to ask someone to drive from Sussex County to Wilmington. It's the moon for some people. But coming from the NOAA conference, what I hear so much is what everyone's talking about today, the collaborative efforts, making the relationships, but really the retention. So if we're able to educate our young high school students and get them into internships and keep the retention and keep them in the community, then they see where they can go and they can prosper. I have dental assistants that are so great, they want to be hygienists. Like, I know I'm going to lose them one day, but I can't stop them. So if they're in a good environment and they see what's available to them and there's progress and there's education and they can find out about it and they don't have to go far, it's in front of them, they see what other people are doing, they want to pursue that. So what's wrong with stopping that? But you're exactly correct. I wish that compact would really take effect because it's coming and we're going to be hurt.
Thank you. We're going to go over here to Ann Painter. Hey, Ann.
Hey, Rita, great to see you.
And you?
I'm the Christiana Care Home Health Senior Vice President. I'm also the board secretary for the Delaware Academy of Medicine, Delaware Public Health Association. And Representative Minor Brown, I love what you've done with the women. I think that is a fabulous program and love to find out how could we partner to further move that along. There is a tremendous shortage of home health aides and patient care technicians in the state of Delaware and across the nation. And if we want folks to age in place, we have to be able to solve that problem. And one of the things that Christiana Care does is we do offer residencies where we actually pay their wage while they're going to school, and we actually support them then in their orientation and employ them full-time at the organization. So if there's an opportunity to connect about that, we'd love it, and to hear any other feedback around what we can do to get more home health aides and patient care techs.
Thank you, Ian. And that goes with your senator. That goes with the aging. Typically, not always, but the largest population that needs the support of home health is typically our Medicare population. Not always, but just something to think about as you are coming up with your priority items for your aging caucus. Not that the people in the caucus, well, yeah, we're all aging.
Caucus on aging.
Caucus on aging, right?
But no, I appreciate it. I think that is a very important point. I think the home health component. I think the challenge becomes what could be paid for under Medicare and Medicaid. And I think, you know, if someone is not caring for themselves properly and want to stay in their homes, they could end up sicker, maybe with a greater disability in a facility or in a hospital. The challenge becomes again with costs, you know, and making sure that, especially in situations where, I'm going to focus on home health for a second here, you know, when you have someone who may be on a fixed income or may not have the resources or whose family may or may not be engaged, reaching out for help becomes difficult, number one, because again, we've done a lot with childcare, but again, we're dealing with different dynamics with someone who may be our parent, and also obviously this person's an adult and they have agency. But how do you find the information? And I want to applaud the DHSS. I've worked with them on, you know, working on ways to get more information about these types of services more readily available. I know there's a lot that's going on there, but making sure that, you know, how do you get the information out? What's the right service for an aging adult? But also, I think a challenge becomes, as a result of the shrinking workforce in this area, what are the minimum hours that an agency would call for? Somebody may need an hour, 2 hours, of service a day, but you're coming across a lot of, you know, agencies and support services say, well, our minimum is 4 hours at X number of dollars per hour. That, you know, can change the dynamic and the decision-making process as people are aging. Yes, they need the services, but they may not want to do a 4-hour minimum. And I have a personal experience with this right now.
So more flexibility?
Well, I think it's more flexibility, but I also understand the economics that are involved here. You are dealing with a supply and demand issue. We do need to have more people who are in the home, if we want to keep people in their homes because the outcomes are better as people can stay in their homes longer, we need to have a workforce that is, flexible, who can meet the different needs, whether they need to be certified to use a Hoyer lift or not, or perhaps has some experience dealing with an individual with cognitive issues. There's a lot that goes into this, but again, we can't forget the caregiver's perspective on this. Again, a lot of very smart people, are suddenly flummoxed and like, where do I go? Who should I talk to? What does my mom or dad need?
So there's opportunity there for us to think about navigation.
And DHSS is doing that right now.
yeah.
They're upgrading their website.
Yeah.
They've got a nice appropriation to be doing that, where we can get some more information out there.
Yep.
But I think it's also recognizing, you're reconciling a business model with individual care needs, and if there's no flexibility on the business model side, because again, these are businesses. These are private sector businesses. If people can't afford them, don't know where to find you, don't know, if it's appropriate, maybe again, the adult, the person who's aging doesn't want them there. There's a lot more that goes into it than, and again, I give Mimi and Senator Kyle Evans-Gay, the initiatives that we've done in childcare, a lot of credit. You're dealing with a different population that you just can't pick up and take to daycare. You're dealing with, and I think that needs to be factored in, as well, and both in-home care and facility.
And I'm thinking some of this dialogue might continue in one of the later panels.